Let's continue our coverage in vaccinating kids against COVID-19. Children 5 years and older are now eligible to get the Pfizer vaccine. Distribution has already begun around the U.S., but parents, of course, still have a lot of questions about the COVID-19 vaccine. So joining us right now is Dr. Stanley Spinner. He is the Chief Medical Officer at Texas Children's Pediatrics and Texas Children's Urgent Care. He is ready to answer all your questions. And thank you, Dr. Spinner, for taking the time to talk with us this morning.
Good morning. Thank you.
And first and foremost, the question is about availability. I know a couple of parents who are not able to set up appointments to get their children vaccinated. So what should parents know, and what do they need to do right now if they want to get their children vaccinated?
Well, so we're working hard, certainly in Austin, for our specialty center through Texas Children's to make more appointments available. We are scheduling Tuesdays, Wednesdays, and Thursdays into, I believe, 7 p.m. in the evening, but I know that those slots are being rapidly filled. It's a great problem to have because we are excited that many families are wanting to get their kids protected as quickly as possible. We'll continue to add slots at Texas, at the specialty center, but, working with the community in Austin, certainly I would encourage families to look for other opportunities. If those spots are not available at the specialty center at Texas Children's, that they could get their kids vaccinated through other entities throughout the Austin area. The goal is to get kids vaccinated. Who gives the vaccine is not as important as the kids getting those vaccines as soon as they can.
Sure, absolutely. And of course, parents are concerned about these brand new vaccines. Talk about the risks associated with the COVID vaccine for children.
Well, when it comes to the risk, I mean, the studies that were done on over 2,000 children in this age group really showed, very, very mild and transient side effects. Soreness at the injection site, fever, low-grade fevers, very mild symptoms. We have not seen anything of any concern in the studies of these kids. And when you look at the, adolescents now that over 10 million doses have been given, and certainly adults, hundreds of millions of doses being given of the Pfizer COVID vaccine, we continue to see an incredible safety profile with extremely low numbers of any types of side effects of consequence. Unfortunately, a lot of the information out there about significant side effects is just misrepresented. We also understand the effectiveness of the vaccine. It has been amazingly effective in adults, amazingly effective in adolescents, and the studies show the Pfizer vaccine in the pediatric population to be also, very, very effective, over 90% effective. I think the big issue is for parents to understand is that children, this is not a benign disease for children. And so that's certainly something that there's been a lot of confusion about. The COVID is really more of a concern for adults, but kids have generally been, spared. And early last year, I think when kids were at home, a lot of mitigating circumstances, homeschool, everyone wearing masks, we didn't see much of a pediatric infection issue. But this year now the kids are back in school, masks have come off in many areas. We have seen a surge in the number of infections in children, and it's pretty much now COVID is probably the third leading cause of death in children, believe it or not, even though it's a small number. Behind cancer and heart disease, we've lost almost 600 children to COVID and well over 20,000 hospitalized. So for even healthy kids, it could be a very, very serious infection, and certainly something parents need to really appreciate the importance of protecting their children.
Third leading cause of death. That is an alarming statistic. All right, I like that we underlined that, Dr. Spinner. Doctors and other medical experts are recommending children get the flu shot right now. So, Dr. Spinner, what is the guidance on the timeline between the shots, the flu shot and the COVID-19 shot?
Well, you can get both the COVID vaccine and the flu vaccine at the same time. There is no restrictions on the timing of it. So if someone has gotten their flu shot yesterday, they can get their COVID vaccine today, or vice versa, or they can get their COVID vaccine today and their flu vaccine tomorrow. So absolutely no issues there. So if you are able to get both at that one visit, I certainly would recommend it. But if that's not the case, again, get your flu shot when you can, get your COVID vaccine when you can. We're seeing extremely low incidence of flu so far, but generally we would expect to see more flu as we get into the winter. Last year was a true aberration. We saw virtually no flu. We don't expect that this year. We do worry that we will be seeing flu, and we understand that the flu vaccine can really help to minimize the severity of the flu, certainly. So it's very important that we try to protect all of us, with the flu vaccine as well as with the COVID vaccine.
Dr. Spinner, we appreciate your time this morning. Thank you so much. Now, we know you have more questions about this vaccine, so join us Wednesday, November 10th for Verified Kids and COVID-19 as we continue to gather more answers for you. Join us on the KVUE.com, the KVUE app, and our YouTube page. You'll also find it on Roku and Amazon Fire TV.